Welcome to Maskaxda Healing. I have Lul here, a therapist, and I'll just start with you introducing yourself, the work you do, how you came to be a therapist, and then we'll go from there.
Assalamu alaikum, magacayda waxaa Lul Noor. I am a licensed psychotherapist and also a licensed addiction counselor. And when did I start therapy? And I went to school for actually nursing because my mom wanted me to be a nurse, like every mom, she wanted a child to be a nurse. So I went to school, and then you have to take a course in psychology as part of the nursing program. So I took a psychology course, and then I just fell in love with the whole concept of psychology. A lot of parts is something I can relate to. For example, like anxiety, OCD, some things that I've seen and things that I've seen in my family or other people that I know. So it was really relatable. So then I went to my advisor and I said, I'm actually don't want to do nursing. Matter of fact, like I have now what is called blood phobia. So I can see so I can see my own blood, like I'm okay with it. But if I see anybody else that is not me's blood, my leg will be shaking and I have problems. So I'm like, I can't be a nurse. So then I switched to psychology. So I have 4 years psychology background, and then I went 2 years masters. And then later, I think a couple years later, I did addiction counseling and I went for a year and a half. So now I have a combination of both mental health and addiction because I'm noticing you can't really separate both. And I worked in a school system also. My background, the beginning training was actually child psychiatry, and I also did school, being a therapist in school for like 8 years, Minneapolis public schools. And then I went to hospitals, and then I did inpatient, outpatient. It was a great journey, and I liked the flexibility because I always had some way like two jobs. And the reason not that I wanted to work a lot is just I liked being in different settings.
I did kind of want to ask with addiction, right? There's like a whole intersection of like they're combined, right? You can't really separate like addiction and mental health. How would you like explain it to Somali though, Aqanin, like the difference between mental health and addiction and like how they're connected as part of the needing the treatments?
Yeah. So like addiction could cause mental illness and vice versa. And that's why sometimes they say is you can't separate them. So with mental health and addiction, both there's genetic aspect to it and there's environmental aspect to it. So for example, a child who struggled with anxiety maybe may have problems socializing. Part of the teenage brain is anything new, there's that dopamine here, there's that excitement to it. So where I'm going with this, let's say if a child is struggling with anxiety, they really want to fit in with some kids that they want to fit in, right? Now they're invited to a party or like a house gathering or some kind of gathering, right? And they're noticing the kids are doing something they don't feel comfortable doing, but there's that desire they want to fit in, that I want to belong, that I want to be part of this kids, that I want to be known or seen, or whatever that child is struggling with. Now they'll try something like whatever it is just to fit in. It could be marijuana. It could be what is the biggest one that we have right now is that kids are really struggling with those small bills, those colorful bills, right? And the reason for that is because they want to fit in to ease their anxiety, they will try that thing, whatever that thing is. And that's when addiction comes in. Vice versa is true. Let's say if a child actually doesn't have mental health problems at the beginning, but because of that desire to fit in, they will try some, it could be marijuana, it could be alcohol, whatever is available in that setting, they will try it. And what we know about addiction, it's a brain disease. It starts with experimentation, but once the brain gets hooked to it, the person cannot control it, either an adult or a child. With children, it's even more severe, right? Because of their brain still developing. So then what happens is they get hooked to this drug that they're using, and now they start developing symptoms of hiding things, getting really anxious if mom or dad find out, right? Now, because of that behavior, now they're developing anxiety symptoms or maybe depression. There could be a shame involved. Let's say a child really never wanted to try that, but tried in because of peer pressure or anything else that was relatable to. Now they're feeling really down that they're, for the first time, they're not talking to their parents about this or they hide in it, right? So again, and that's why the vice versa comes in. And with addiction and mental health, the genetic piece is, for example, if there's a family history of depression, most disorders are genetic. So let's say if a parent has a bipolar disorder or depression, their child is very vulnerable to get that because it's in their genes. And it will come up in different situations. So for example, if we go back to that child that experimented this thing because wanted to fit in, and now because of that they feel really shame and feeling down, and now they start isolating. So then one of the things that parents need to pay attention, any behavioral change to that child. So if they notice any behavioral change, it's either there's something they're struggling with. It could be addiction, it could be mental health, but there's something in a service that coming up. So if I go back to that child, now this child has vulnerability of depression. They're not aware of, but it's in their genes. And now because of this situation, and they start isolating, these symptoms will come into the service. Does that make sense? So then, and with addiction is very similar. Addiction is also genetic. There's a genetic aspect to it. Culturally, and this is something they start talking about recently with khat as a stimulant. And let's say if my grandfather was using it, my uncle was using it, it's in my genes. I'm not aware of it because it's culturally acceptable, right? And now I'm introduced to a stimulant here. So I'm highly vulnerable to this drug because of my genetic background. And a lot of parents, what I tell them too, like a lot of these things that come to the service, they come in, it's not because the child is bad or they're misbehaving. It's actually in their genes, but it triggers different situation triggers it.
Like it's more of like the environmental and the biological factor too, because I've had experiences with family members with addiction that don't accept the mental health component of it. There's a lack of understanding the fact that in genetic, sometimes like you said, environmental trigger. And I think a lot of times people don't understand the biological component. Like they just think, like this is something, a behavior that can be controlled. What would you say to like, well, Dinto, that don't understand how it's not behavioral controlled, like it's not something you can control, like ilmahan kibrahay, and some of them they think treatment is sending them back home, but like you said, also like back home, like they don't consider qad as a part of like drug muqanan.
Yeah. It's socially acceptable. Yeah. I mean, it's the same here with alcohol. Alcohol is socially acceptable, but there's some degree to it when it becomes an addiction, right? So it's very similar. Yeah. So what would I say to these parents? I would say to them that I think there's also a shame involved with parents too. And when we tell them this is actually genetic, you'll see some of that shame goes down. Like it's not, they didn't bring it to them. Yes, like everything starts as an experiment. Addiction is a brain disease. Once it's happened, it's really hard to blame the person, right? And so what we could do as parents is to help Ilmaha with treatment. But first to say, okay, and the reason it would end, whatever it was at that time, but now how can we do something about it? And I think what happens is there's a disconnect between the parent and a child because one is a shame. Second is the lack of knowledge from the parent's side to support this kid, right? So then what happens is relationship could way baba that the child could just go off. Let's say if they started something small, it become bigger. So one thing I will tell parents is like before into wahwaynani stage right? And then we stage by first acknowledging yes wahwayn whoever the fault it was, but what can we do about it?
I agree, yeah, like focusing on solution based, maxa kacaawin kartaa situation right now, because
Also about addiction, they don't believe it's a brain disease, but they think it's like us. That's why like a lot of people they sympathize with other like other diseases, right? Even with mental health. But when it comes to addiction, because of that label, this is your problem. But the reality is addiction is a brain disease, and also there's a genetic vulnerability that parents themselves يفهمين. And now actually they do a CT scan or Maskaxda Healing before addiction to tonight. They show you a normal brain and they show you a brain that gradually tartib or addiction because it takes time to the brain doesn't change. So it shows even the stages, even the beginning of stages, the brain was like physically the brain changes. And that's why it's so hard. It's so hard. Even قفك مجو كبحة, they go back because of the triggers.
And I have some questions just kind of about the culture and stigma here. What are some myths about therapy that you heard from Somali clients or Waladinta? It can be addiction or mental health.
I said, no, I'm a therapist and I tutor قفك لاسمي. And then she's like, "محك عاونيسا." I say, I'm gonna play with him. عيونك على عياري سوفيو. So the idea of how is play gonna help this child? But the idea is too with parents, the idea of like therapy is supposed to fix this kid or توسع عيونك وحا قلبا, fix him. That's not what therapy is, right? But it's also interesting too, like the idea of what's the benefit of therapy. يعني محاكي فإذا هذا قفل شاكست, right? Right. So a lot of it is also knowing the benefit of it, and so a lot of education piece related. Especially, I think it's really hard for me at the beginning of therapy to convince a parent how again ala shake sanaya is going to make him better. But one thing I used to do is I would invite the parent to the session, especially in Maskaxda. They used little kids like 6 years old, 7 years old, 10 years old. So I would bring them to the session, and then when he's playing out whatever happening at home. So all the games over there. So what I do is I just have games set up for the kid. I just let him do whatever, and I just observe. So the first 2 sessions, just observation. And from the play, I'm noticing the family dynamic. I'm noticing actually what's happening at home, and and I'm seeing all this from the play. So then I explain to the parent, this is what's happening. And then they start ترتيب وفهمي.
That visualization kicks in, yeah. So like they're more interested afterward, like after the fahman from all that, okay, observing, yeah.
Yes, absolutely. Absolutely. Even their relationship changes with the child. Like, for example, what I try to do is change their perception a little bit. So I'll say, if I see, like, Hoyo, she sees the good or not necessarily maybe aggressive play or something. So basically, and what she's doing is maybe she's cleaning the dishes, she's doing something, she's busy, but then she's noticing this kid. So the way I change their perception is I say, instead of thinking in wax قربه, why don't we just, he's just taking, you're giving him a little bit of space or عيارة. So now I'm changing the language. So because she doesn't think in wax قربه, she's not getting angry. Now she's translated to عنق وعيارة, then it's like her emotions, it went from up, down. Yeah. And they're a little bit calmer too. Yeah.
Yeah, mashallah that you did that work. I, hope a lot of people see that benefit because it, like you said, mafahmayan the benefit of like therapy. Because like, what do you think when people are trying to like put your iman down or say that iman kada hoseo if they iman kada this and then afmada qade, and it's like like you said when the whole point of like therapy and treatment, because it's like jirkena markaan xanuunsanahay or medical reasoning, right? Like caafimaad waan doonanaa ilaahayna waa ku kalsoonahay qofkaas ma dhahano iimaankiisa yar. So yeah, I just hope that awareness helps people understand the benefits of therapy, and I think the way you broke it down is amazing.
And then too, like if we go to the there's a lot of imams who are educated in mental health who's actually telling the people this. So like let's say even with deen, like every udhr there is a medicine for it. And part of our deen in asbabka u qaadana, we have to do what we could do first, right? And part, yes, عذر kasta ilaahay daaweyna, but still asbaabka in qaadatid waa. That's why we still dhakhtar u tagno, dentist u tagno. And maskaxdana ma ka baxsano jirkeena kale. I don't know why we separate them. It's not separate.
And if anything is more like maskaxdana dee shaqaynaynin or caafimaadsaneen, jirkeen is also like they don't, yeah. I think a lot of people separated the two, but I think with the medical part, like it's how you said it's normalized, right? Or like it's something that's like culturally, like they injure by like get it or shilbukale, like it's something that we have reasoning and we understand. So people try to think it's separate, where like they don't see maskaxda or they don't understand.
Yeah, absolutely. And I think you said one thing about the seeing part. Si jirkeena dhan waa ujeed, maskaxda ma arki karno. And that's why we struggle with it.
I'm a brain and behavior fan too. I did my bachelor in psychology.
Yes, yes, it's actually my favorite part. But also too with the brain, like let's say jirkeena dhan has a function it plays. So for example, qalbiga, what does it do? It pumps, right? Pumps blood to the whole part of the body, so we survive. Our brain also has a specific job. Yes, yes. So our brain
Yeah.
function is to survive. It helps us survive. That's why we have a lot of negative thoughts. And the reason we have negative thoughts is shaqada our brain is to keep us safe. It's a survival. Our brain helps us to survive. صح? And that's why majority of maskaxda and afkaarten were negative. Not because qofkan negative is because the brain is only doing its job. So marka sometimes saas u fahamno, we're able to understand maskaxden.
Do visual with people too that understand, if you ever go into teaching, do more visual with that because the way you broke it down, it's helpful to see it, the brain regions and the functions, how it works.
Absolutely. But you also brought a good point. We have two different parts of our brain, since you say you're into neuropsych. So there is a logic brain and there is an emotional brain. Which one do you
Emotional.
think we exercise more?
Yeah.
And why do they tell us not to take decision when you're angry? Or when you're upset, or when you're sad, or when you're emotional, in some ways, or anxious.
Focusing on that emotional part, like, and we don't see the other perspectives or what's going on. Like, I think, like, it's more of like, in the hand, them why, and then we're only focusing on qalatka. That's how I see it, yeah. When we're going off based on emotional mind.
And then like the emotional brain takes over, and then the logic brain goes to sleep. That's why when you're angry, take a time off. So you're giving yourself a space to cool down, so that because the intensity of emotions is really up at the beginning, and then when you take a break, it goes down, and then your logic brain is slowly وصل قلمش. Or one thing you could do, قف kala hadli karta. If you're in an argument with your child, with your spouse, with your friend, right? You're more likely to react to qofkaas or maybe hadalo xun kaa soo baxaya. And that's why they say take a break and go back to that conversation again. And there is a reason for it because the brain needs some time to switch.
I used to be the reaction part. Like, I would just like blur out, like you said, react and say things to the other person that's hurtful that I don't mean because I'm reacting on that emotional part, right? So
Yeah.
I think learning what helps you, like you said, talking to someone else or like going for walks, just taking space to like decompress, focus on.
Absolutely. And there's a science that back it up, and also deen to backs it up.
Mindfulness, they don't understand that it's part of our deen because a lot of times Dean Tana is talking about mindfulness and we don't realize that it goes along with therapy treatments as well.
So with mindfulness, let's take the prayer. Salat al-Dukuna,
Yeah.
5 times a day and Dukuna, right? What does when we salat al what do we do?
Being present in a tukati. And we also did the mindfulness part where like bahena with doing subinena mahana and also like we were following through this ritual of being present.
Absolutely. And then two, like waxaa lagu dhaha markii salaada ku jirtid and afkaar maskaxda kuu soo dhacda waxaa dhehaysaa acuudu billahi min ashaytaan rajiim. And then what happens? That's the idea of mindfulness.
Don't understand that exactly like therapy treatments is also had dintena on subinol or dintena a commit to high buhan subinol. Yeah.
Yes. And that's something I'm really interested in. I'm interested in studying the religion and looking at it from the psychology aspect of it. I'm saying her name right. She's part of Al Maghrib Institute. She's, I think, a doctor. She's a lecturer, but she's also has a background in psychology. And that's one thing I'm so interested because see, with Dinta, because culturally, Dina sokorni, Dina lene. So if we could, with Dinta, we could relate to. If I could find things like mindfulness, now it's related to Dinta in terms of prayer, then that it makes sense to them because I can't just talk about cognitive behavioral therapy, CBT, DBT. Like I lose people. I lose people. But if I slowly make them understand the concept of mindfulness actually in your daily prayer, and then you're supposed to be focused, and a lot of people will tell you visually, imagine sit because khushuuc heshid in ilaahay ku joogo, which is true, ilaahay wuu joogaa, but we don't visualize it. Visualization, and then you have the mindfulness that every time you distract, you come back. You say, "A'udhu billahi minash shaitanir rajim." You come back to your prayer. You pay attention to surah al-akhrinaysid, right? And also pay attention to the movement, your body movement. Because you know what I mean? Yes. So every time you say that, but you're coming back, the idea of being mindful of either whatever you're saying, what you're practicing, but even there's something called mindfulness eating. That sometimes we eat and we don't even know, and that happens to me, especially if you're eating TV first and then you realize, wow, when did I finish this? Yeah, yeah. So we could do mindfulness eating, and also the idea of mindfulness. Like even right
Yep.
now, we're practicing mindfulness because we're both present. We're both focused on what we're talking about. So the idea of being fully present at that moment is mindfulness.
And people, I think, like you said, when you break it into part like that, like how we already use it in our daily life, it becomes easier to be open and understand, okay, like therapy is like kind of like a skill, a way of life of how you can live, or the skills that, yeah. Do you have anything else kind of to end it with that you would like to share how we can help elders or parents understand more, or like just anything else that you would like to share with the community?
I just want to say, like, mental health is real, addiction is real, and it happens to everybody, right? And sometimes it happens to us because we're genetically vulnerable to it. It's not in our fault that we have mental health or addiction. And as I was saying earlier, every hudur ilahi wuxuu keenay medications. And when I say medication, not necessarily doesn't mean like medicine, but psychotherapy is medicine because you're talking to a person or ilm leh oo waxaan soo bartay. But I would also say before you reject something, try it.
To try something out, yeah.
Absolutely. And then maskaxda iyo jirkeena kale, they're not separate. They're one. They don't have the energy to help themselves or help their loved one or even help the mujtama', right? So maskaxda is very important. Actually, I would say is the most important organ in our body. And we have to take care of it just like how we take care of our dental hygiene, our yearly checkup that we do. Maskaxdan too, we need to talk to people. Even if you don't want to do a specific of like therapist utago, how about if we start in our own circle? We create our own circle of that that we love each other, but the idea of don't be alone with it. So one thing I would end with mental health, do not be alone with it.
And because the more you're alone, the more you go into that dark cycle of like, I think a lot of time with isolations and people don't understand how dark our thoughts can become when we isolate. Yeah. Well, I love that you talked about your experience, and I'm like happy to have you on here just to kind of educate others and bring in awareness. I was going to say, please share any way that people can connect with you, or any way that like social media or platforms that you want to share with others. Anything else that you would like to end it with? I think you kind of went over what gives us hope to kind of look into therapy and like treatment in general. I think just like you said, building support system. Like if you're not ready to go towards that treatment part, having your own social circle and taking care of yourself. And you're right, Maskaxda basically controls everything, right? So it's if we're not taking care of our mind and body, like they're all connected, that's how we get to like shut down, tired, depression, anxiety. I think self-care too, and that's what they struggle with the most, and not knowing like you need to take time to check in with yourself.
There's also this concept, it's called interception. Interception means just looking inward and listening to your body signals. Like let's say هذا مضحي حنونة. That signals your body is telling you there's something happening. عروشك حنونة. So even with the idea of sitting with yourself, just take 5 minutes and listen to your body. Like, am I feeling like jirhanu? So your interception means your body signals that's communicating to you. So that's also part of self-care. Just what do I need? Like, do I feel thirsty? Should I go use the bathroom? Right? You're checking in with yourself. One thing I would say too, like therapy is not scary. You don't have to go and get a diagnosis. And a lot of people too, they go, let's say there's a decision in their mind that they want to make, but they want to go and talk to somebody. They have goals they want to accomplish for the year. They want to go talk to somebody. So قصب معهن therapy means a diagnosis. Yes, diagnosis would jira if it's applicable, but it's not all the time. And sometimes it's not the reason that people see us.
Professional oo ku caawinaya like intaad like you said, even choices, transitions, you know, like sometimes like we might go through like choosing shaqqa or position that impact us.
Marriage, should I pick this partner? Is he the right guy for
Yeah.
me or the
Yeah.
right woman for me?
And definitely. I think that's another misconception too. That therapy just means waxa kaa qaldan or waxa like waxa caawisa u baahan tahay, but caawis waa u baahan tahay for your own like to cope with the challenges that life brings because everyone goes through challenges. Thank you for bringing that up because that's important.
And then, yeah, no problem. And also the idea of seeing not even a therapist, but let's say you want to talk to Khuf or Wayne, Khuf has some kind of knowledge. And I think we have that culturally. We have that we always go to somebody, right? But now with therapy, is that that could give you a different perspective, right? And give you a better decision. So حتى if I look at it as, okay, maybe I'm coming a little bit from child perspective, let's say أنا قاعد إفهم سنة waxa qaldan. Like every time there's a miscommunication, always something is going wrong. So if you see a therapist for like maybe a couple weeks or even 2 months, you start noticing, wait a second, my relationship with my child is better because now I changed the language sida ula hadlay. Ano xanaaqsan ma la hadlin, tartiiba ula hadlaa. So even like qofka wuxuu ku baraya ma ahan clinical.
Yeah.
It could be just
Yeah.
life skills. So I'm trying to say it's more broad than أنا كنت بس kusoo qaybini qof wax ku dhacay maskaxda ka jiran yahay ama laga
Yeah.
يعني oo laga quustay camal. And it's not true.
You know, waalidiinta like ayay wala tashan jiray, right? Like markay wax dhacaan or like qof weyn tasha ahaan like waa weydiisanaysaa waxaa suubin kartid, and you're right, that's basically what a professional will help you with. Well, I'm really happy that you joined and share your knowledge. I think it's muchly needed. Hopefully you can become a teacher, or I don't know if you ever want to come back to teach us topics.
Yes. So I'm getting certifications in and what I'm learning about child development, your specific behavioral problems for kids, for example, like ADHD, autism. So that's the certification I'm going. But with psychotherapy, I've been doing it for over 12 years now. 8 years with being with children, families, and the rest was doing more
Mashallah.
inpatient,
Yeah.
outpatient.
Thank you, Abaya. I appreciate you for coming on and talking about it.